Welcome to the What If It's Not Depression podcast. I'm your host, Dr. Achina Stein. And today we are going to talk about how not to detox. My guest is Dr. Vivian Chen. She's a medical doctor with 15 years of clinical experience. She is board certified in the United Kingdom in both internal medicine and family practice, and now lives in California with her family. Her world turned upside down when her daughter was hospitalized soon after being born with symptoms no doctor could figure out. Through doing her own research, she was able to help her daughter recover. Does that sound familiar? She also realized that the many years of chronic fatigue, acne, and brain fog she had was due to environmental toxins. We treat our kids first, and then we treat ourselves. This opened the world of root causes that she had never considered before as a conventional medical doctor. When she moved to San Francisco, she decided not to get licensed as a medical doctor in the United States. Instead, she now coaches clients back to health virtually by identifying and addressing root causes. She's also on a mission to help people reduce their toxin load because she believes environmental toxins to be one important root cause that not enough doctors are talking about. And that is so true. Not enough doctors are talking about it. It's always the gut-brain connection. That's me. and about stress and food. So let's go to toxins. Dr. Viv, welcome.
Oh, thank you so much for having me, Dr. Achina. Your story really resonates with me because I think we both went through a very similar way of healing our children first and then us. Mm-hmm. So thank you so much for using your platform to raise awareness and helping others.
Oh, it's my pleasure. And listeners, if you like this episode, please click the like button and subscribe. So let's dive in. I want to know more about what it was that your daughter had that nobody could figure out. Like, oh my gosh, what was that?
Yeah, so she started to fuss and just not breastfeed properly from a very early age. So around 2-3 weeks old. And it kind of got worse and worse. She was diagnosed with having reflux. So, you know, that typical clinical presentation of feeding, arching the back, and then coming off the breast. That's reflux, right? Automatically. So she was put on anti-reflux medications by her doctors. And that medication dose was increased and increased, and then another one added, and nothing helped. And eventually she got so bad that she just refused to feed completely, became so dehydrated and had to go to hospital and be tube fed.
Wow.
And in the hospital, the team that looked after her said they did a pH study, right, that showed it's not reflux. So if it's not reflux, what could it be? They said it was a behavioral issue, at which point I was just like, okay, you know, enough is enough. Right. I'm not accepting that an 8-week-old baby would have behavioral issue. Babies have an instinct to feed to survive. It just doesn't sound right. And, you know, up until that point, I had kind of relinquished my control over to our healthcare providers, right? People who are taking care of us, because I didn't want to interfere, right? As doctors, we don't want to interfere with the care of our own family because we're not always objective. Right. But that was the point that, you know, my whole world just turned upside down. I said, no, I have to save my own daughter's life. Right. So I delved into the research, and I found a paper from 1983 that talked about her symptoms of feed aversion, and they associated it with cow's milk protein allergy. Wow. So basically the protein from the cow's milk would cause sensitization in the gullet, and basically it's kind of like a picture of eosinophilic esophagitis, or inflammation in the gullet. So there's a lot of immune cell attacking the gullet, making it very raw, you know, like if you have eczema or break in the skin, that kind of thing. So if there's food touching it, it's very, very painful. So that's what happened. Like it was painful for her to feed every time she stopped feeding. So I showed that paper to her team. they said, okay, well, we got nothing to lose. We don't really know what's wrong with her. Let's try switching her milk. So we switched her to Neocate, which is this hypoallergenic formula that's used to treat cow's milk protein allergy, basically.
Mhm.
And after a week, she started feeding normally again.
Wow.
So yeah, so it was because of this really rare form and presentation of cow's milk protein allergy. And that was 14 years ago. So it wasn't known about. Nowadays is a lot more known about, feeding aversion can be a symptom considered as part of like a non-typical presentation of allergies. So it's a lot more known about, but back in those days, it was really rare.
Wow. Wow. Well, I'm glad you were able to do that. And how is she doing now?
She's doing great. Thank you for asking. She's grown out of her allergies completely. She was also diagnosed with a peanut allergy, egg allergy, very quick soon after
Mm.
the milk allergy. But luckily, she grew out of all of them at the age of 4. And yeah, she's doing really well now. Thank you.
Awesome. Awesome. So tell me how you segued from that into environmental toxins. Can you connect the dots for me?
Yes, yes, that's a great question. So after she was diagnosed with these allergies, I was left with the question, why, right? Why does she have these allergies when I don't have any allergies? My husband doesn't have any allergies. Like, where did this come from? And of course, her allergist said, oh, it's just one of those things, probably genetics. And I was like, well, it's not genetics because we don't have the gene, we don't have these conditions. Um, and so I delved into the research, and I started to see papers that were talking about, environmental toxicants confusing our immune system and tipping it towards the immuno kind of sensitive arm. So there's the Th1 and Th2, and just tipping that balance between the two immune system can actually make the immune system more allergenic or more kind of autoimmune, right? So she probably does have some sort of genetic predisposition, but her immune system tipped towards the allergy arm.
Mm.
Um, and things like mercury came up, phthalates, right? So I was thinking, well, I at the time had 4 mercury amalgams. So mercury amalgams are the silver fillings,
Mhm.
and they're not made of silver; they're made of 50% mercury. And the conventional kind of dentistry and medical way tells us or teaches us that these mercury is inert; it doesn't get vaporized, when actually studies show otherwise. And there's actual cadaver studies showing that, the amount of mercury in somebody's brain correlates with the number of amalgams in their mouth.
Wow. Yeah.
So yeah, like the more I read, the more I was thinking, well, could this be what's causing or contributing to her very rare allergies? So I started cleaning up our environment, because I'm N of 1. I don't know this. This is me starting out 14 years ago, just not learning any of this at medical school, and
Mhm.
just trying things on myself to see what happened. And slowly I just noticed I started feeling better. So like my many years of fatigue, like I started to have more energy. My skin cleared up. I had cystic acne. I needed multiple rounds of Roaccutane to treat that. My
Mm.
bloating went away. And then, her allergy, I think, I don't know at what point it started to resolve, but, with time, a couple of years, she was tested and she grew out of her allergy. So I think that was the point I started to become really convinced that there could be something there, like, something was plausible
Right.
because it worked for us.
Right.
So I started to kind of tell my patients about it. And then, they would come back and tell me, hey, that post-nasal drip went away after you told me to stop using these cleaning products.
Right.
And so the more kind of case reports in my own practice that I saw, the more I was convinced there was something there. And yeah, that's how I delved into environmental medicine.
Awesome. Wow, what a great story. What a great story.
Thank
So,
you.
I just want to add so that the listeners know, and you may not know this, but just recently, the American Dental Association put out a statement indicating that that amalgams were harmful to your health. I may not be quoting it exactly, but I can include that in the show notes so that people know about that. But
Thank you.
just very recently that came out with. So I'm so happy to see that because for years, so many years, dentists would say that it's safe. But
Right.
they did start offering a composite, which who knows if that's as safe. And I would love to know if you what you think about that, but probably safer than
Right.
mercury. But yeah, I think we're making some headway in terms of enlightening the public about the problems with toxins.
Yeah, for anyone who does have silver fillings in their mouth and listening to this, please don't panic and go out and tell your dentist to remove them right away, because they have to be removed safely, with rubber dam, with separation, like high suction ventilation and things like that. So find a dentist, a biological dentist who is trained in amalgam removal, and do it safely, because I see this all the time. Like, people panic, they go out, get it removed, and they feel much worse because the vaporization is really heavy when you're drilling.
Absolutely. Yeah. And I thank you for adding that. I did have an episode with a biological dentist. If people
Amazing.
want to find that episode and learn all about biological dentistry, you're welcome to look on the channel and view that interview with Dr. Sylvia Vanis, I believe her last name was, at the Biomedical Center in Providence. And so,
Great. I will go check
yes,
it out
we have
too.
several biological dentists in the Rhode Island, Massachusetts area. So
Amazing.
yeah,
Yeah.
yeah, and there's great websites to locate one if you guys are interested. If anyone's interested, they are in the show notes of that interview where you can locate biological dentists in the country. So
Perfect.
yeah, so
Yeah, but Mercury would be high up on your radar too, right? As a functional medicine psychiatrist, like it's a neurotoxin. So is that something you also look for, toxicity?
absolutely. Yeah. It's one of the things that we do in terms of environmental toxins. We do get serum blood levels, and then there's urine tests and hair tests that we can potentially do. So we start from the foundational work first and see
Love
how the
that.
cards fall, and then go from there. But certainly history is really, really important. And looking in the mouth. So as part of my physical exam, I do examine the teeth. And I recently actually had a patient who had a gold tooth right next to a silver amalgam. And so when you have two metals touching each other, oh my
Mm,
gosh, that's not good news. So that can make people very, very sick. And there's lots of information about that on the internet. When you have two metals in the mouth, you can actually have little shocks.
microcircuit.
Yes, exactly. It creates a circuit that can cause lots of inflammation. But
Yeah.
anyway, we diverge. I can talk about this forever.
Yes.
So tell me, what are some of the other environmental toxins that you find as being high on the list for you besides mercury?
Yeah, one of the really kind of abundant and difficult to avoid one that has been shown in lots of studies to have an effect on our immune system or endocrine system, is phthalates. Phthalates is a group of lots of different compounds that's used for different purposes. One is to make solid things softer. So they're kind of plasticizers that, for example, your shower curtain made of plastic, it's made pliable and flexible with the use of phthalates. It's also used to fix scent onto things. So your personal care products that smell nice, your air fresheners that smell nice, that often has phthalates in it too. So the common places are, your flexible plastic, like your rubber duck, and then your personal care products. And it is really it's just so abundant that it's found in 93% of Americans when they're tested by the CDC. So the CDC runs a biomonitoring program. So they actually monitor for these chemicals in Americans, and phthalates are ubiquitously found. So it is something that we can do things to avoid, even though they're ubiquitous, right? So we do have control over it. So it's very helpful to know about it, be aware of it, and then take some steps towards reducing.
Right. Yeah. Avoidance is the key for sure. But as soon as you said, the rubber ducky, right? Look at all the toys that are made for our children that's made out of these plastics,
Right.
including, the binky, right? The pacifier.
Right.
It- wow. That's
Yeah.
you're constantly um, bathing that child's saliva with this plastic.
Yeah. And, children or little toddlers, they gum everything, right? So they're in their bath, they're probably
Mhm.
gumming on the rubber duck and
Right.
just, yeah. And then it's these things kind of detach from the toys, right?
Mhm.
The compounds can detach from the toys and start traveling around in the house on dust particles, and it's inhaled into our body that way. So
Okay.
if you cannot, it's always an overwhelming topic, right? Like people
Yes.
start thinking, oh my goodness, it's everywhere, what do I do first, right?
Right.
So what are some simple ways to reduce the exposure? Number one, obviously, if you can, avoid plastic, but also just making sure that you vacuum regularly. Like people don't realize this. A lot of these toxins travel in the house on dust particles, not just phthalates, PFAS, like lots of different flame retardants. They ride on dust particles, and then as you walk, it's kicked up into the air. We inhale them, and so vacuuming regularly and damp dusting. So using a wet rag to pick up the dust and then rinsing it off, not using a duster that's the dry type, like you kind of dust like that, and then it's like in the air and you're breathing more in, right? So
Oh, okay. Yep.
yeah,
Makes
things like
sense.
that. So there are simple things, and opening up your windows every day for 10-15 minutes can really make a difference to your air quality. And we breathe 11,000 liters of air per day. So one of the first steps is just to make sure that the air that we breathe at home is as clean as we can make it.
Mm-hmm. Absolutely. Yeah. Your home is the most toxic environment you can be in. But there, right? It really,
Sadly,
sadly,
yeah.
yes. And, just eliminating some of the scented candles that are not
Mm.
real scents. Getting candles is fine, but making sure that they're true scents. My biggest pet peeve is Febreze.
Oh,
That
yes.
so many people are allergic to it, and I can walk into a room and know that Febreze has been, because I just start reacting to it. So
Same.
yeah.
Yeah. Yeah. And it smells horrible. Like, I don't know what is so attractive about them. Like, it's so artificial smelling. It
Yeah.
doesn't make the room smell nice to me anyway.
Right.
Like, essential oil smells so much nicer, and just like fresh air smells good.
Right. Exactly.
Yeah.
I agree with all of your recommendations. And I think the big thing is also plastics, that people are, and I try very hard to avoid plastics, but it's so hard
So hard.
to
Yeah,
avoid
because
it. Yeah.
it has made our lives so much more convenient
Hmm.
over the last 40, 50 years. And the really sad tragic derailment in Ohio recently has really just highlighted that it's not just that the plastic is bad for us on a daily basis. Even the manufacturing of it can lead to the pollution of our environment. It's not just going to affect local residents there. Like the plume is going everywhere. It's like going in the air, and we are all connected around the world, right? Like I don't think
Yes.
any of us is going to travel in the atmosphere and settle somewhere, settle in our ocean. The ocean is all connected. So eventually these things come back in our body. So yeah, like we have to, I mean, if we're looking at root causes as functional medicine doctors, then the root cause is like how we are treating the planet, really.
Right, right. So before we overwhelm people too much and start getting them so depressed that they start watching this episode, I would like you to just touch upon whether or not in your research you have found what the connection between these environmental toxins and depression and anxiety or mental health issues, because research obviously is not done on this, but I would be so surprised if they weren't connected on some level. I'm curious if you found
Yeah.
research.
That's a really interesting question. I've seen research showing association between things like Alzheimer's
Mhm.
with environmental toxins, mercury, aluminum,
Mhm.
lead, but not so much on depression, anxiety, but we do know that these environmental toxins can trigger inflammation.
Right.
And inflammation, as I understand, and tell me if I'm wrong,
Mhm.
is actually can be a central cause of brain inflammation, which then can have symptoms like depression and anxiety.
Absolutely. Absolutely. Yes. See the root cause
Right.
of.
So it might be kind of like a roundabout way. And,
Mhm.
maybe I haven't come across research that directly links, but I feel like there is a link.
Yes.
Um, but, also through, a lot of these environmental toxins, like the heavy metals, like the phthalates, they impair mitochondria function, right? And mitochondria is the battery, the powerhouses inside of our cells, and they produce energy for the cell to work. And without energy, the cell cannot work properly. So if it's in the brain, the brain cell cannot work as well. And so you're going to start getting brain fog and, probably lower mood and things like that. So do you feel like there's an element of mitochondrial dysfunction in a lot of depression and
Oh,
anxiety?
absolutely. A major cause is fatigue. Absolutely. Yeah. So, yeah, there's a high concentration of mitochondria in your heart and muscles and the brain.
And the
So, the brain
brain.
absolutely is going to be affected. Uh,
Mm,
uh, so, yeah, I consider the brain to be the hard drive that's in your head, right? And the mind and the
yes.
emotions to be sort of the software, right?
Right, right.
Uh,
And there's also the neuroimmunoendocrine circuit, right? That the connection of those three systems that are interconnected and affect each other, like the like our nervous system with the endocrine system, those two systems are communicating with each other.
mhm.
And then the immunology part. So,
Yep.
people who have allergies, what's that impact on your endocrine system and on your nervous system too. It's
Absolutely.
it's really interesting, like that, a lot of people with eczema, for example, the eczema flares up when they're stressed out, right? And that's the neuro
Right.
immune am I getting it right? Endocrine,
Yep.
connection there.
Right. Right. Absolutely. Yeah. Yeah. It's all connected for sure. Yeah. Been a lot of research connecting cancers being caused by these toxins, environmental toxins.
Yes,
Obviously, the most obvious being what people do with cigarettes, but
right.
we're exposed to a lot more toxins than just cigarettes. There's a great deal of research in that regard. But I was just curious about what you thought about with the mental health piece. So
Yeah.
so tell us how to not detox. Finally, we're here. What
Yeah, I love
what
that. So, I mean, we talked about this toxin avoidance, exposure avoidance, number one step, right? Because if you can reduce the toxic load in the first place, there's less detoxing to do.
Mhm.
And I think that that's the first step that a lot of people miss because they like quick fixes. That's really hard work, right? Toxin exposure requires work. If I can just buy pills that says detox, then that's way easier for me just to be popping pills 3 times a day. But what I've seen in my practice is that when you don't prepare your body and when you don't open up those detox pathways and reduce your toxic load first, taking pills can actually backfire. So I see a lot of side effects from detoxes because I guess it's a pre-selected population that, suffer, and then they're looking for help, and they find me and they come to me because they like what I say online.
Right.
But I had a client with lead toxicity, and she was put on this a very well-known detox program for heavy metal detox. But she was so dizzy as a side effect, she couldn't get out of bed for weeks and weeks. It was so severe because what was happening is that these supplements that she was taking was mobilizing the lead that was stored in the tissue.
Right.
So it's mobilizing and bringing out into the blood, which now is, traversing through your major organs like your brain and your nervous system, your organs. And so if those toxins can't very efficiently leave the body through your detox organs, it's actually doing more damage because it's now at a high concentration in your body and it cannot leave. So the body now needs to quickly stash them away. So they just end up going back into storage and they're not really leaving your body. What you're doing is just stirring it back up.
Right.
And then nothing leaves because the detox pathways are blocked. So when I'm talking about detox pathways, I'm talking about the major detox organs like the liver, which breaks down the toxins and sends these toxins via the bile into your gut to be pooped out. And that's one pathway. And it's very important that the toxin has a straight line through that pathway and not be blocked, right? If you're constipated, toxins are blocked, it's being reabsorbed back into your bloodstream. If your bile flow is not optimized, it's sluggish because you're stressed out all the time, you're eating, looking at your phone. Toxins are not leaving your body, right? So those are very commonly blocked pathways. And then there's the sweat pathway. Toxins leave our body through sweat. Studies have shown that heavy metals, BPA, are found in our sweat. And kidneys, like through our urine as well. So yeah, those are the major detox pathways that need to be clear so that when we do use supplements to pull out toxins, the toxins are leaving.
Right. So the important thing would be to make sure that you're moving your bowels, getting that bile flow going. And if you don't have a gallbladder, to use bile salts and perhaps to make sure that you're making enough bile. I
think the bile, without a gallbladder, the bile is just not as concentrated, right? Because the gallbladder is concentrating it and storing it. So there's no like the kind of timed response with your meals, because eating and the taste of food and the delivery of food is a trigger for bile to be released, right? So it's more like a constant drip of something more dilute. So yes, I guess some people need bile salts, but although I've seen that to cause diarrhea in a lot of people as well. So I think it needs to be personalized to
Absolutely.
that person.
Yeah. Some people have a lot of difficulty digesting fats. And so if you're having that difficulty, then sometimes that translates in terms of being able to break down fats.
Yes.
Which are toxins. Usually fats and toxins are kind of combined, right?
Yeah. And then there's also the phase 2.5, right, of liver detoxification, which a lot of people don't talk about, which is, once toxins are broken down your liver cell, they need to actually traverse that membrane to get into the bile. And toxins getting from inside the cell to the bile is an active transport process. It's not a passive, like, I'm just going through like a door that's open. The door has to be open. It's an energy dependent process requiring nutrients, and actually can be blocked by things like stress, mycotoxins, so there's a lot of blockages along the way that actually are common because of our modern lifestyle, high stress, poor nutrition, poor sleep. Those things that actually down-regulate our detox pathways.
Yes, I agree. Yeah, I find that with my patients that stress is probably the hardest thing to regulate out of all of the things. They could have the perfect diet and they're taking all their supplements and they're sleeping fine and moving their bodies, but they are still not able to, detox. And I think stress
Right.
is the biggest reason.
Right.
So,
And there's one thing that I want to just talk about as well, which is I'm seeing a lot of in my clients right now, is people are going to online to buy these what's called binders, right? Like these are binders that supposedly bind onto toxins and pull them out of your body. But by the very nature of the fact that they're binders means that in the environment, they're binding onto toxins in our environment. So a lot of them are contaminated with the very toxins that you want to detox from.
mm,
And now if you combine that with a blocked pathway, let's say you're taking binders and you're constipated, well, those binders are now sitting in your gut, possibly releasing toxins back into your body. And I've seen a couple of cases of patients who start detoxing and their levels are higher after they start taking these binders, which is just like mind-boggling to me, right? So this is why I'm so passionate about how not to detox, because I've just seen it done wrong so many times.
right.
And it's just heartbreaking because people are spending so much money and getting nowhere and probably getting worse.
Right. Yeah. I think it's important to know which binders to take if you're going to take binders and why you're taking them for what
Right.
purpose. There's specific binders for specific toxins.
Yes.
They don't bind everything. And you have to be sure that you're taking the proper doses so that you're not also binding and the proper time so you're not binding to your vitamins and minerals,
Nutrients.
nutrients
Yes.
that your body
So
needs.
important. Yeah. Which are then needed for you to detox too. So,
I know
yeah.
it's so complicated. It's very complicated for people. So,
Yeah.
so is any I would love to segue unless you have anything else to say about this piece, about anything else you want to mention about not how not to detox, because I would love to talk about your loom box.
Oh,
And
thank you.
yeah, why don't you, is there anything else you wanted to add to that part before we transition?
I think that how not to detox is just please don't just look at quick fixes. Quick fixes don't work when it comes to detox. Like it takes many, many years for toxins to build up in your body. And you should expect that your body will take a while before we can bring that toxic burden down. We have the detox organs built inside of us. We just need to support them with the right lifestyle and nutrients, and they can work quite well unless you have a super high load, in which case you should be directed by a doctor, not just randomly taking supplements. So that's what I want to kind of leave everybody with.
Yeah, yeah, great, great. So, Dr. Viv did not know that I actually got the loom box. I'm just getting off screen to show everybody.
Oh,
So,
I'm so honored.
she, did you invent this? I'm not.
So I spec'd it
Uh-huh.
because the backstory to this is that my dad was really he was bedbound in a lot of pain
Mhm.
with piriformis syndrome that was misdiagnosed as sciatica. So for about a month he was just couldn't walk. He was back in the UK. I'm here in America. So things got so bad I literally flew home and just had to take care of him. And I brought a red light device I had at the time with me, just to kind of have him try it because I had read so much research on red light therapy, photobiomodulation, which is a fancy name for red light therapy,
Mhm.
and pain, inflammation. So it worked for him, but this device was not powerful enough. It meant that he basically had to use it for like 2 hours a day on
Oh,
the site because it's not very powerful. So I was like, you know what? There's not one that's portable, that's powerful enough where like, we just need to do 10 minutes, 15 minutes a day. So I created one that was a little bit bigger with enough power that
mhm.
you don't need to be, treating the area for hours and hours. And also, I wanted to make sure it's safety tested because a lot of the units on the market are not safety tested.
Wow, wow. So, yeah, she's so humble. We got together to talk, and she thought we were just going to talk about toxins. Like, no, we want to talk about Lumebox too.
Oh, thank you so
Yeah,
much.
yeah, so I've been using it for my eczema. That was the reason why. Uh,
Oh,
got
okay.
and I play ultimate frisbee, so for recovery. And my husband has some knee issues, so like let's try it out. And it's
Oh,
and I think I used it longer than I should, as we were talking before we started. Like perhaps I'm using it for 15 minutes and I should only be using it for 5.
right. Because it's so powerful for the
Mhm.
skin. The skin only needs very little light energy. So with Lumebox, you only need to do 5 minutes.
Yeah.
Otherwise, it's actually a little bit too much
Hmm.
for the skin. But yeah, for other tissues, because you want to penetrate deeper, like,
Hmm.
for the knee, you can use it for longer because the deeper in the tissue you go, the less light energy reaches that tissue.
Hmm. Hmm. So tell us more about Lumebox and what exactly that it does, because it has lots of different settings.
Yes,
And what is it,
yes.
and for what other conditions besides what we just talked about that would be useful for?
Yeah, it almost sounds like snake oil when I talk about red light therapy sometimes because, I'm talking about skin, I'm talking about joint, I'm talking about muscle recovery, I'm talking about mood. And I think the main thing to remember with red light therapy is that it's targeting the mitochondria, which is
Mhm.
what we mentioned earlier in our conversation. And mitochondria being the powerhouse inside of our cells, when we can help our mitochondria produce more energy, that cell can now do its function better, whether it's your brain cell, whether it's your immune cell, whether it's your muscle, whether it's your skin, right? So wherever the cell is receiving that energy, if you can support the mitochondria, that cell can now function a little bit better. And so that's why we're seeing such a vast array of different effects and benefits in research. And there are over 2,000 published scientific papers on PubMed on red light therapy. So if you search photobiomodulation in one word, photobiomodulation, if you type that into PubMed, more than 2,000 papers on it. And there's, covers so many different conditions. There are some really good review papers as well, like to talk about all the different conditions it's being shown to be beneficial in.
Hmm.
But I think you'll find this really interesting. It doesn't have to be directed at the organ that you're trying to benefit, right? So a lot of people think, oh, I need to shine it on my head for mood support, for example.
Right.
Well, there are 2 studies that showed that if you shine the light on your back, so there was a mouse study where they shined the light on the back, and the depression got better.
Mhm.
And also another human study, small trial, I think around 18 patients who had lower back pain and depression, and they trialed 2 different treatments. One is red light therapy, and I forget what the control was. It may be a pharmaceutical to treat the back pain. So they got the patient's back pain better, but the patients who received red light therapy also noticed that their mood got better as well. So that's really interesting. So what's happening, I think, underneath all of those benefits is that when you support the mitochondria, you are having all these kind of knock-on effects on the body, right? Firstly, the cell has more energy, can function better, but also the mitochondria is not just responsible for energy production, it's also responsible for triggering the antioxidant production in the body, right?
Oh.
So the mitochondria is involved in what's known as the cell danger response, where like the cell through the mitochondria can sense danger in our environment
Mhm.
and starts to regulate the cell, like, hey, shut down your energy production, or hey, ramp it up. And you need to trigger antioxidants now to fight this toxin, right? So the mitochondria is kind of like the sensing organelle to regulate the cell, to tell this, to protect it in a way.
Right.
So if you remember to like the last time you feel sick, for example,
Mhm.
right, you probably felt very tired, right? Like, oh, no
Mhm.
energy, want to go
Right.
to bed. Well, that's actually a very smart response by the body, by the mitochondria to, it's like, oh, we're under attack. Let's reserve our energy. Let's ramp down energy production. Let the immune system take over so that, let's make this person very tired so they're not expending their energy like running around. They're using their energy to fight this virus, right?
Right.
So it's just so smart. But anyway, I digress. There's the energy production, there's the antioxidant system that the mitochondria can trigger. And also when you shine red light therapy on a tissue, there's an temporary increase in nitric oxide. And nitric oxide helps blood vessels dilate. So you get increased blood flow. And that, can also bring more nutrient to the area and help with healing and recovery.
Right. Awesome. That was a wonderful explanation. You did a really nice job explaining how it's all connected, because it is a very complex system that we have here, and we don't give enough kudos to our mitochondria.
Yeah. And, toxins, poor inflammatory diet, stress, poor sleep, they're all stresses on the mitochondria, right? And day in, day out, unless we are recovering the mitochondria from the stresses, day by day, the function is declining, right? And I heard somebody, I think him, Ari Witten. He's really big on mitochondria and energy. I think there's something about it with every 10 years, there's like a 30% reduction in mitochondria function or something like that. So it's not aging that's giving you your ailments.
Right.
Could it be that is because the mitochondria is now getting so stressed, it's not able to function as well as it used to? That's a really interesting perspective. And going back to your earlier question about there's so many different modes on the Lumebox. So there's the red mode, there's the near infrared mode, and there's the combined mode. Because you can use red light therapy for so many different kind of benefits. So red light is better for surface. So red light doesn't penetrate the skin as well. So it's really good for things like skin, wound healing, and surface things that you want to treat. But near infrared is the wavelength that penetrates tissue a lot better. So if you have something that's deeper, like joints, muscle, you want to use near infrared frequency. But very often I use both. I just use the combined mode because, there's, for example, for skin, for acne, there's studies showing red can be beneficial and near infrared can be beneficial. So I use both. Even though it's for skin, I use both because studies have shown that both have been beneficial. But for brain, like mood support and things like that, it's mainly the near infrared wavelength that has been shown to be beneficial, because that's the wavelength that can penetrate this tissue. And the skull is very, very thick, right? So you need a wavelength that can penetrate well.
Awesome. Yeah, no, I'm really enjoying using it, and I'm feeling like I'm getting benefit from it because my eczema is clearing. But I can't say that it's just that, because I'm doing all sorts of things.
Right, exactly. And that's the thing. It's never just one magic cure, right? It's a combination of different things usually in medicine.
Yeah. Absolutely. Great. So yeah, it's our time to stop. We kind of went over, but we also started a little late, but I just wanted to let people know that you have a free quiz online at www.joindetoxright.com/quiz. And that people can find you on Instagram at plateful.health. And your website is platefulhealth.com.
Yes. Thank you so much.
Oh, you're welcome. So, and just so you know, listeners, she is doing consultations as a health coach. And I think she's an amazing resource if you find that you are stuck in some way where you've done all the testing and you're on supplements and you're reacting to supplements, or you're detoxing or having trouble detoxing. She might be a really great resource. I think it's always good to have fresh eyes on a situation. Sometimes even the best clinicians, practitioners, doctors can, sort of go around in circles with you, and it's like, oh, I didn't see that, and I can say that's happened for me as well. And it's nice, always nice to have fresh eyes. So use Dr. Vivian Chen as a consultant uh, on your situation if you think you need some help.
Oh,
Great.
thank you so much for having me. And yeah, likewise, I will be sending my followers to you. So I know mental health is a really common challenge right now, especially after the pandemic. And I feel like your book, it will help so many because people don't realize there are actual underlying root causes that they're in control of. So thank you so much for your work. It's amazing. Thank you for helping everybody.
Thank you. Great. It's my pleasure. And take care.